the big breastbone and push it in a little bit. And it should be able to kind of move in like a little bit, like maybe like a half an inch. So I'm pushing in the sternum, right? And I'm trying to get some movement happening here. And you'll see some people are like, what do you mean? So I'll give you a side angle. As I push, it's like it collapses my chest a little bit and it opens my back. Okay? So you're pushing in to this part all the way like where that notch is, right? You're pushing in and you're looking for a little bit of movement. That doesn't mean your shoulders are coming forward. It's like I'm pushing my chest in. Okay? I want to start creating some movement, right? And there needs to be some movement, because if it's super tight here, your lungs are trying to, fill up, and they won't be able to because they reach this wall. So it's like they're pushing, or they're trying to fill up, but you can't get a really good breath of fresh air because your everything's just too tight. So you're creating some kind of movement here in the sternum to begin with, right? And then as you start to kind of feel it, you just push less and less. It gives you kind of more of a direction, and you start to maybe move out towards like the chest area, and you start to do the same thing there. You want to feel that, if it comes across in camera, yeah, you want to feel that you can push in like an inch or so, right? And you're starting to get some movement. And if not, it's fine. It'll take some time. But you want to start creating some movement in the upper part, into the chest, rib area, sternum, right up until like just before the solar plexus, right? And you just start creating some kind of movement here. And then as you start to feel it, what you're going to do is you're going to maybe imagine, if you will, like you have like some sort of a pen here, something like a sticking out of your chest, and you're going to start to kind of slowly make some circles. Again, it's not a shoulder thing. Shoulders we did last week. It's more that I'm imagining the sternum and creating a little bit of movement here in the chest. And it doesn't have to be much. And you can imagine either circles, one way or the other way. Different size circles too. It can be small, and then they start to become bigger and bigger. And again, you're just working with this part of the body, and you're trying to get some movement happening there, because it's just really, most people, it's very, very, very tight. You can suck it in, push it out, cave it in, cave it out, and then kind of start to see if you can make some sort of a circle movements happening. Now, as I'm doing this, of course, my back is also moving, right? Because they're connected, right? The sternum, the ribs come around, connected to the back to where the spine is. And then I'm going to kind of lift my hand up and kind of grab the back of my neck. And what I want to do now is in this area. So I'm trying to imagine, in this case, my left side. So imagine the ribs as they go around and wrap around to my back. I'm trying to see if I can like open them. So if this were the ribs like that. So I'm trying to like lengthen them down, kind of open them. So you can imagine them kind of opening, right, as I reach. So it's not just the rising of the elbow, but it's the elongating of the ribs, allowing them open, right? You can try it on the other side too. So again, visualize the ribs and like how they're spaced, right? Because I'm not really reaching now. And as I reach, with my elbow up, I'm focusing on this part, not my shoulder. And if you want to just touch it, you can actually feel it, right? You can actually feel how you're instead of your shoulder reaching, the ribs are opening. And then you can try it with both, lastly. So again, my shoulders are not really involved. I'm really thinking about reaching and opening my ribs, relaxing my ribs. Put my hands down beside me. And now my shoulder blades in the back. So think of so first I'm just going to pinch them, right? And then I'm going to open them. I'm going to pinch them. So remember, not so much the shoulder, right? I'm pinching them. I'm opening them. Pinching them. Opening them. And then if I can, I'm going to try work with just going to give you a visual of my shoulder blade. I'm going to try to see if I can get some movement. Now, what's interesting about the shoulder blades is that in many cases, it seems like they're stuck on the back of the ribs. So it's like the shoulder blades are so tight. There's so much tension in this top chest part that the shoulder blades, what the shoulder blade needs to do is glide smoothly across the back, right? So you're looking for creating some movement in your shoulder blades, right? Again, it's very easy for the shoulders to get involved, but try not to use the shoulders. And I'm just trying to move my shoulder blades. I'm trying to see how much movement, how low I can get them, how high I can, how open I can make them, how close I can make them. And at the beginning, it's kind of tricky because if there's lots of tension, you won't be able to move it as well. But it's like I'm really trying to keep the focus in and then I can go back to like my chest a little bit, and I want to be able to kind of move this area too, like the side, right? The sides, and then the back, not low back, upper back. Everything is up here, guys. So so chest a little bit, ribs a little bit, right? Ribs on this side a little bit, and then my back a little bit. And I'm just kind of bouncing. I'm kind of playing back and forth with these things. So chest, ribs, back. Awesome. So it's just kind of like a warm up a little bit for this part, right? And it's also like a kind of a small test for you to see how this is moving. If it is moving at all, right? Now, something that can help you is for me is I sometimes like to kind of just take my hands and push into them. So now I'm actually pushing my ribs, and by pushing this set of ribs, it pushes this one out, right?